Everyone knows Americans spend more on healthcare than any country in the world, and second place is a very distant second. In a study that ranked 70 healthcare metrics across wealthy countries, the US scored dead last. It ranked worst on life expectancy, health outcomes, access to care, infant mortality, preventable deaths, and more. But none of this is surprising when you understand how the system works. So in this video, I'm going to explain how the richest country on earth built the world's most expensive, least effective healthcare system, and who profits from keeping it that way. In late 2024, United Healthcare CEO Brian Thompson was shot outside a Midtown Manhattan hotel with the words "delay, deny, and depose," a reference to insurance company claim denial tactics found engraved on the used bullet casings. I remember watching the news thinking, they're in for a shock, because it felt like the media predicted Americans would grieve, or at least decry the act, but the internet instead responded with sympathy for the alleged shooter. But anyone who's participated in the US healthcare system could have explained why. The social media erupted with healthcare horror stories, cancer treatment claim denials, $800,000 bills from routine surgeries, AI systems overriding doctors' orders for organ transplants. One woman posted a thread of her flat feet problem from like 15 different angles. Wait, maybe that was just my feed. You know, despite seeing doctors less than other developed countries, Americans spend $5.3 trillion on healthcare every year. That's more than the GDP of Japan. With America's annual healthcare expenditure, you could buy every game on Steam, every NBA team, every NFL team, Ford, Starbucks, Nike, Coca-Cola, McDonald's, and Disney. And then you could spend that amount 4 more times. Around 2020, I got a medical appliance from a specialist in the US I'd waited months to see. I won't tell you what it was to protect my privacy. It was a penis enlarger. Anyway, this device cost over $6,000 out of pocket, but luckily I had insurance, so I only had to pay $600 plus the appointment fees. What a steal. Flash forward years after receiving the device, and the doctor's office sends me a bill for $6,200, which made no sense because they got prior authorization from my insurance, and I already paid. So I called and asked if they could prescribe me whatever they were smoking, and they said, there's nothing we can do. Called the insurance company, they denied the claim, you're on the hook. Well, you can guess what happened when I call my insurance, right? The doctor's office is to blame, actually. They billed it with the incorrect code. Contact them. This cycle repeated for months, until I finally got a written statement from my insurance confirming that the billing was incorrect. I sent it to the doctor's office and said, look, you messed up. I paid what I owed, fix the bill, or write it off. Non-Americans might think, okay, so they fixed the billing and got paid. But Americans know that no, they sent me to collections, so I was stuck with a $6,000 bill or a credit score of 12. Because despite medical bankruptcy being practically unheard of in other wealthy countries, it happens to about 530,000 American families every year. If you're watching this video in the US with 2 friends, statistically, one of you has medical debt. Also herpes. But how is that possible? I thought the point of insurance is that you pay a monthly fee and the insurance company covers most of your medical bills when you go to the doctor. Well, imagine you own a gym. Think of your ideal gym member. No, not like that. It's probably someone who forgot they even signed up, but still pays the membership fee every month. They never dirty the equipment, they don't pee in the pool, they don't use towels. As a gym owner, it's like collecting rent money without having to lease your space or equipment. Insurance companies are similar. They want someone who pays a membership fee and doesn't utilize any services. Think about it. The average cost to insure a family in the US is about $27,000 a year. That doesn't include co-pays, deductibles, out-of-network fees, vision and dental visits, claim denials, etc. When you have millions of Americans on your insurance, maybe it's time to stop having kids. Also, that's a lot of money in monthly income. So insurance companies collect a membership fee and try not to pay out. They say, look, you're only allowed to go to doctors on the list we give you. They offer plans with huge deductibles and out-of-pocket maximums, or more simply, they deny claims outright. Maybe the billing code was wrong, maybe someone involved in your care was out of network. Maybe it's Tuesday. Maybe you, that's why. You know, United Health Group is the largest health insurer in the US. It's facing a class action lawsuit alleging that the AI system it deployed in 2020, which doubled denial rates, was wrong 90% of the time. And it's a shame, because if they had used humans, they probably could have tripled denial rates and been wrong almost always. Many people think, it's illegal for insurance to just deny claims, otherwise what are you paying for? Unfortunately, it isn't. At least not in practice. And the complexity of our system protects profits for, well, basically everyone but you. So having insurance doesn't necessarily protect you. Of course, it doesn't take a genius to see that this seems stupid. I bet even some of my viewers are starting to catch on. And in fact, the United States is the only developed country in the world with this system. Do you know why that is? It's the same reason we have freedom and use ounces. America's just better. Actually, the US healthcare system was a complete accident that continues to haunt us. During the Second World War, President Roosevelt froze salaries because he was worried about inflation. He told businesses you can't raise wages to attract workers. Except he probably said it like, "The working man's stipend is frozen, and so too shall it remain until such time as I personally unfreeze it." I don't know if that's how FDR sounded. But that's like a corporate wet dream, right? Sorry, you want a raise? I legally can't give you one. But higher salaries attract and retain skilled talent, so companies got creative. They didn't raise salaries, but they started offering health insurance as a benefit, which was legal. Then the scariest three-letter agency in America, the IRS, made employer-provided health insurance tax-exempt, creating a massive incentive to tie insurance to employment, and the number of Americans covered by health insurance grew exponentially. This is the original sin of US health insurance. No one decided that Americans should only get health coverage if their employer provided it. It was a temporary wartime loophole. But the consequences of this so-called accident of history are still killing people today. If you lose your job, you lose your insurance. Jenkins, your report is all over the place. Look at that. Is that Times New Roman? Holy shit. It's like you're reporting to Ramses. The first. I'm sorry, sir. My chemotherapy leaves me with a little brain fog, but I promise I'll clean it up for you right away. You know what, Jenkins? Don't worry about it. What? I'm gonna fire you. Then you won't have to worry about anything for much longer. Because you're gonna die. And it's a prodigious challenge to get health insurance as an individual. You can't walk into 7-Eleven and buy a plan. You have to go to CVS, and they're always out of stock. No, individual plans have limited options, are ridiculously expensive, and have enrollment windows for purchasing. Isn't that insane? You can't buy one whenever you want. You either have to purchase during open enrollment from November 1st to January 15th, or have a QLE, qualifying life event, which triggers an SEP, special enrollment period, like getting married or losing coverage, then purchase within that SEP. Confused? Well, that's too bad, because if you expected to get a job quickly but couldn't find one, then fell outside your SEP, you better hope you don't get sick until next November. So freelancers, gig workers, self-employed Americans, of which there are tens of millions, must navigate the individual market alone and pay full price for plans that big companies get in bulk at a discount. Oh, and by the way, dental and vision insurance are not included with medical because why would they be? So that's an entirely different cost. And once the system was established, enormous industries emerged around maintaining it. So it's not easy to abolish, but we'll get to that later. For many Americans, it's literally more effective to start a GoFundMe campaign, about a third of which are for medical bills. So if you ask Americans why healthcare is so expensive, understandably most blame insurance companies. But there are 3 other structural problems keeping healthcare costs high that you should know, starting with America's secret cartel. Remember how insurance companies tell you which doctors you can and can't see, like a jealous soon-to-be ex? Well, picture 2 hospitals that provide identical care. One has a bunch of competitors, while the other is the only hospital system in the city. Insurance companies can't prevent people from going to the only hospital in their city, so the hospital with no competitors gets to make exorbitant demands. It tells insurance companies, if you don't accept our prices, your customers have to leave the city to go to the doctor. Insurance companies must agree, and the hospital charges whatever it can get away with. That's the hospital cartel. Maybe you're thinking, it's not like there's only one hospital in my city. How common can this be? Today, not a single highly competitive hospital market remains in the US according to the standard FTC metric, so pretty common. In the last 20 years, over 1,000 hospital systems quietly merged, and with this consolidation, healthcare prices rose dramatically, while the quality of care did not. Hospitals that charge hundreds of dollars for a Tylenol could now charge thousands. Of course, insurance companies don't want to pay higher reimbursements for no reason, so hospitals and insurance companies indignantly blame each other while passing costs to you. When testifying to Congress, the Purchaser Business Group on Health CEO said hospital pricing is utterly irrational. It is not related to quality, it is not related to safety, it's basically whatever a hospital can charge and get away with. You'll see this yourself. If you get an outrageous hospital bill, ask for it to be itemized. Oftentimes it suddenly gets smaller because they charge you $2,000 for a cup of water. And speaking of surprise billing, did you know that doctors at in-network hospitals can be out of network? Let's say your insurance approves treatment at Hospital A. After waiting 4 months to see a specialist and hoping it's not cancer, you go, get an ultrasound, then receive a bill for thousands of dollars. Why? because you didn't have to get totally naked for a belly ultrasound and the nurse was traumatized. Also, because even though Hospital A participated in your insurance plan, Dr. B did not, and you happened to be examined by Dr. B, so get f***ed, I guess. In fact, research found that many patients who intentionally visited in-network hospitals during emergencies were treated by out-of-network doctors and got stuck with the bill. And when you're having a heart attack, it's somewhat burdensome to spend 45 minutes on the phone in the Uber, because an ambulance would bankrupt you, checking insurance participation for both the hospital and individual doctors because the info on the website hasn't been accurate for a decade. But at least we don't spend $1 trillion a year on paperwork. America spends about $1 trillion a year on administrative waste. Our healthcare executives actually have the most expensive plumbing network in the country. Get it? Administrative waste? It's no secret that the US healthcare system is complex. Every insurer has its own rules, billing codes, reimbursement schedules, prior authorization requirements, claim appeals processes, etc., which translates to an astronomical amount of money entering the health sector that has nothing to do with providing care. Entire departments exist to deal with billing complexity that shouldn't even be a thing, and the money that pays someone to convert office visits into billing codes has to come from somewhere. Why not you? So, while efficient healthcare systems spend single-digit percentages of their total healthcare spending on admin overhead, we're spending 20 to 30%, which is not just a higher percentage, but a higher percentage of a higher total. So that $1 trillion gets baked into what you pay in premiums, at the doctor's office, at the pharmacy, which segues into the last structural problem, and one you already know and love. In Canada, a vial of insulin costs about $30. In America, it costs $300. Advair Discus, a medicine for asthma and COPD, is about 1,300% higher in the US than the average international price. One course of Sovaldi, a hepatitis C cure, costs $300 in India. Guess how much it costs in the US? Did you say $84,000? If so, you're right. And guess what else? The US government helped fund Sovaldi's research, so not only do you pay more for it, your tax dollars helped create it. Many factors contribute to America's drug pricing problem. Most countries have government price controls, but the US system is stupider. Pharmaceutical companies game the patent system to prevent competition. We allow drug advertisements to drive up demand for expensive prescriptions. But the most interesting and least discussed reason for America's asinine drug pricing is something you've never even heard of. Do you know what a pharmacy benefit manager is? When you get a prescription through your insurance, the CVS pharmacists don't light candles in the back room and summon your pill bottle from the underworld. Except for antidepressants. I'm pretty sure that's where those come from. There are a bunch of companies involved in getting that drug to you. PBMs are like mediators between all the parties that are supposed to negotiate lower drug prices, but in practice, make your prescriptions more expensive. How do they do that? First, PBMs make money through rebates. Drug manufacturers pay PBMs to get their drug onto your insurance's approved list. So instead of choosing the cheapest or most effective drug for you, PBM could choose whichever drug pays them the most. Not that anyone in American healthcare would choose profits over health outcomes. Additionally, PBMs do something called spread pricing, where they charge your insurer one price for a drug, pay the pharmacy a lower price, and keep the difference. And they don't have to tell anyone how big that gap is, so they make billions inventing whatever numbers they want. Finally, the biggest PBMs don't only manage your drug benefits, they also own pharmacies. So vertically integrated PBMs steer you toward pharmacies they own, making money on both ends. The title of your tape. A 2024 FTC report found that 6 PBMs control 95% of US prescriptions, which is an enormous concentration of power. Usually the story ends there, but in a rare healthcare win, the FTC has actually sued, and there's bipartisan agreement that something needs to change. But until it does, the only thing you can do is ask your pharmacist if there's a cheaper version they're not showing you. Because there probably is, and it's probably not the PBM's top earner. Now that you understand why the US healthcare system is pee-pee poo-poo, you're probably frustrated. Or you're not American and watching with Schadenfreude. And if you're like me, stupid, you might have the urge to actually do something about it. So let me share my brief campaign to fix America's healthcare from the inside. For my MBA, I enrolled in a school with a very reputable healthcare program. One of my peers actually became the CEO of a social media platform health tech company you may know, Hub. As a frankly cherubic young man who life hadn't slapped the idealism out of yet, I thought maybe I could help fix the system that assiduously f***ed me, f***ed my friends, f***ed my family, and millions of Americans every year. And it's crazy I got admitted because I used that exact phrasing during my interview. I think I also used the word martyr and saint. Now, I did my MBA very young, and I'd never actually worked in healthcare. And in one of our first meetings, they gave us a target healthcare function survey. Basically, like, what do you want to be when you grow up? And the three options were payer, provider, or biotech pharma. I saw the sheet and was like, what the hell are these? And looked around the room thinking someone was going to ask for clarification, but everyone had their heads down writing their answers. So not wanting to look stupid, I wrote payer because, I don't know, it sounds like you'd need fat stacks to be a payer. I didn't realize that meant I'd be condemning cancer-riddled grandmas to death on my yacht. Like, I'm on my yacht, not that there are guillotines on my yacht for cancer-riddled grandma. Anyway, I quickly learned that healthcare uses a lot of jargon to prevent outsiders from having any idea what's going on. What do you mean my MA plan denied the DME because my NPI wasn't linked to the right TIN, and now it's pending an ADR with the MAC? And in this case, payers means insurance, providers means hospitals, and pharma means drugs. Now, I'm not going to sit here and pretend like not every industry loves acronyms and buzzwords that make insiders look like they know more than they do. Because when I'm justifying my salary or trying to impress someone with a trust fund, I'll take any help I can get. But the problem with American healthcare is that you have to self-advocate in a system that's designed to make money for everyone at the expense of patients. And it's exceedingly hard to do that when there's a 3-mile moat of jargon, complexity, and bullshit that the average person doesn't have the time or means to conquer. So after the meeting where I wrote I wanted to be a payer, I visited my program director and said, look, I may have made a mistake because I don't even know what a payer is. I probably shouldn't be considering a career in health. I expected they'd agree, but they told me that's normal. I routinely have professors ask me to explain the difference between our insurance plans because healthcare terms are so complicated. Then they sent me a resource for complete beginners that would get me up to speed with healthcare jargon. So I went home, opened my laptop, and guess what? It was like 75 pages, a book of acronyms, diagrams, and jargon just to have a basic conversation about healthcare in the US. Of course, the average person can't argue with their insurance when they don't know the difference between a PPO and an HMO. I didn't last long in healthcare. I took some classes, consulted a few healthcare companies, which in hindsight is hilarious, and learned that although the US system is a catastrophe, and everyone knows it, it's not a secret, the evidence has been overwhelming for decades, it's almost impossible to change. Here's why. The US healthcare industry is the single largest lobbying force in American politics. Insurers, hospital systems, pharmaceutical companies, and med device manufacturers spend more on lobbying than any other sector. Money in politics is a massive problem for America in general, but healthcare is particularly bad because the entire system relies on inefficiencies and constitutes a massive part of the US economy. And when an industry becomes that large, it develops extraordinary political influence. In this case, to maintain those inefficiencies. A 2025 study from Oxford found that insurers donating more to politicians in higher corruption states obtained higher Medicare and Medicaid premiums and faced less regulatory scrutiny. In other words, spend on lobbying, make more money. The paper called this pay to play. When my program director addressed basically any question about why the US healthcare system was so poorly designed, they'd say, follow the money. And I initially viewed that as a lazy non-answer. I later realized it was an accurate explanation for why nothing changes. And for a long time, people seemed successfully brainwashed into thinking it had to be this way. A single-payer system would never work in America. It would cost more, actually. It's going to raise your taxes. It's socialized medicine. Ew. Our doctors will have no incentive to provide good care if they make less. They'll probably give you the wrong prescription just for fun. You'll have no medical freedom. The government will force you to go to Dr. Moron who graduated last in his class and amputates the wrong limbs. But do you even know what the other options are? And why do we rarely discuss them? I recently visited universities in Taipei and was discussing gig work with an economics professor who was a big proponent of the gig economy in Taiwan and asked my perspective as an American. I was like, yeah, it's great being able to spend $40 on a Chipotle order at 2 a.m. and have it be wrong, but also in America, gig work often doesn't include benefits. The professor was like, what does that mean? I said, health insurance in the US is offered as an employment benefit, but contract workers don't get employee health insurance. So if they're struggling financially, they can't afford medical bills. The professor looked at me like I was joking, but I said, no, seriously. They asked, what happens if they get sick and need treatment? I said, well, some people believe if you're really pious, you get to try again. And they couldn't comprehend how a single mother working 80 hours a week as an Uber driver and online assistant on Fiverr could get cancer and not be able to afford treatment. That's because the Taiwanese healthcare system has been ranked #1 in the world for years. Here's how they did it. In the late 1980s, Taiwan had healthcare coverage for only about half its population, so the government decided to build a universal system from scratch, and they studied healthcare systems from around the world, taking the best elements from each. Of course, one of the designers noted that America's was not really a system that should be copied. Instead, Taiwan chose a single-payer model, and in 1995, the National Health Insurance, or NHI, system launched. Okay, so how does it work? Well, the NHI is mandatory for all residents, like 99.9% of Taiwan's population is covered. Every person has a smart card containing their medical info. Instead of having like 15 different MyCharts that don't talk to each other and 3 insurance cards in America, in Taiwan, you swipe the smart card, the doctors see your data, and you get care. The government negotiates all fees directly with providers, sets prices, and imposes a global budget cap on total system spending. Remember how the US spends about 20 to 30% of our healthcare costs on administrative overhead? Well, Taiwan spends about 1 to 2%. So what's the catch? Taiwanese doctors must suck, or patients must get stuck with huge co-payments. No, actually, quality of care is great, and they cap out-of-pocket costs to prevent financial disasters. Okay, but what about freedom and choice? They probably force you to go to specific doctors, and there are even longer wait times to see specialists than in the US. Nope. Wait times are short, and Taiwan allows patients to visit any specialist or hospital without needing a referral. Conversely, your US insurance restricts the doctors you can see, and usually requires referrals for specialty coverage. Okay, well, it must be expensive then. Well, it depends on how much you make, but the average NHI premium is about $42 a month, so it's less than the $800 a month my American insurance cost. I mean, public satisfaction with NHI is like 90%. And yeah, it is ranked #1, but it's not such an outlier that no other system can learn from it. And it's not even true that you need a single-payer system to be better than the US. Consider Germany. Not for too long. It is important to remember how to tell jokes, but Germany has no single national insurer either. You can keep your private insurance if you want. You can keep your choice of doctor. Nothing gets nationalized, and they still spend over $5,000 less per person per year than we do. Now, this still doesn't even cover everything wrong with America's healthcare. The solution is not as simple as, institute a single-payer system and all the problems go away overnight. But it's easy to see that the US healthcare system is in fact not broken. It's performing exactly as designed. It's just not designed for you. My channels still don't often show up on YouTube search, so if you want to see me again, I'd subscribe and turn on notifications. And if you want to make my day, follow me on Instagram by clicking the link in the description. See you next time.